Hello, today my name is Eva Berger and today I am presenting electroanalgesia and pain management. When we hear the term electroanalgesia, first we have to think about the background of the word to fully understand and grasp its meaning. So the prefix electro is concerned with the meaning of electric or in relation to electricity, while analgesia stems from the Greek word for pain, which is algos, and an, as an analgesia, is the denial of a word, so no pain. So overall, what can we get when we put the prefix and the word together? Yeah, electroanalgesia uses electricity to ease the pain that a patient may feel. How does it do that? It cancels out the pain by irritating sensory nerve fibers of the affected area with an electric current. What does that mean? We attach electric pads or something like that, electrodes on the skin or under the skin of the patient to interfere with the signals that the nerve cells, so the synapses, share with each other. One main principle that one needs to understand the principles of electroanalgesia is the gate control theory. This theory states that pain can be reduced by activating a non-painful sensation. So when some part of your body is hit, for example, your thumb by a hammer, which would be a painful stimulus, but you rub that part by deep touch, it reduces the pain. Why? Well, when you receive the painful stimulus, alpha, delta, and C fibers are activated. These are the primary neurons, here marked in this green color, of the tractus spinothalamicus, responsible for pain sensation. These fibers run as the primary neuron and they synapse with the secondary neuron in the substantia gelatinosa in the medulla oblongata. Excitatory neuron transmitters transfer the signal from the first to the second neuron. An important neuron transmitter to mention here would be glutamate. We see this transmission on the enlarged picture, so the A delta and the C fibers are in green and the secondary neuron is the one in blue. The excitatory postsynaptic potentials in the membrane of the secondary neuron are increased. This leads to action potentials. This action potential travels up as the tractus spinothalamicus, and then we see the second synapse between the secondary neuron, the blue one, and the tertiary neuron, that's the one in purple, and the lateral nuclei group of the thalamus, where then at last it's transported to our sensory cortex, which makes us aware of the pain. This path, however, can be interrupted at the level of the substantia gelatinosa, so the enlarged picture that we see in the middle. When deep touch is placed onto the hurt part, it activates the Pacinian corpuscles in the dermis of the skin. This sensation or this feeling of the sensation is transported by the DCML tract. This goes same as the primary neuron into the substantia gelatinosa. One part of it goes up and doesn't cross on the same side. So that's the small part that we see crossing away from the DCML in the large picture in blue. And the other part of it crosses at medulla oblongata. This inhibits the pain signal. But how? It activates the inhibitory interneuron, that's the gray one, which then releases enkephalin. This enkephalin can do two things. It can either bind to the cell body of the secondary neuron, leading to its hyperpolarization. This later leads to a decrease of action potential frequency, which would release the pain. Also, the enkephalin can bind to the opioid receptors of the axon terminal of the first neuron. What does that mean? Well, the first neuron now can release less of the excitatory neurotransmitters, so there's also less excitation of the second neuron. This also leads to a decrease of action potential frequency and a decrease in the pain signals that are sent to the brain. One type of electroanalgesia therapy called TENS uses exactly this theory. So TENS is short for transcutaneous electric nerve stimulation. And what it does, well, first of all, how is TENS applied? You have two electrodes, or at least two electrodes, that are attached to the part of the body where the patient feels the pain. There's two different types of TENS depending on the frequencies. So you can apply low frequencies such as 2 to 4 Hertz, or you can apply high frequencies such as 80 to 150 Hertz. The therapy of TENS has a direct and short-term effect, meaning as soon as you deattach the electrodes, the pain will be back. What does TENS do? Well, it stimulates the other fibers so that the tractus spinothalamicus is interfered with again. So our pain soothing system is also activated because the neurotransmitters like serotonin are released. And overall, TENS helps to increase the blood flow through the affected area, and also to stimulate the muscles, which is always helpful in the further treatment of the affected area. Another type of therapy would be the SCS, which is short for spinal cord stimulation. This kind of therapy, in comparison to the TENS, is for people with chronic pain. So when every other pain management therapy doesn't appear to work, usually spinal cord stimulation is used. This is actually the most used method in neurostimulation, and it's quite invasive. So as you can see in the picture, there is an electrode which is surgically placed under the skin, and then also by triggering the interneurons that we have seen in the picture before, in the medulla spinalis, the pain is reduced. So where's the difference to TENS? Well, the spinal cord stimulation, as the name already suggests, sits directly on the spinal cord. In comparison, TENS sits on the skin, so it's not as invasive, but also cannot be used long term. Or it can be, but it always has to be reapplied, whereas the spinal cord stimulation can work overall for different parts of the body and is way more useful, but also comes with the risk of an operation. But TENS and SCS are only two ways where electroanalgesia is used in pain management in the medicine today. Other areas would be transcranial electrostimulation, deep brain stimulation, peripheral nerve stimulation, percutaneous electrical nerve stimulation, percutaneous neuromodulation therapy, transcutaneous electrical nerve stimulation, transcutaneous acupoint electrical stimulation, gate wave therapy, interferential current therapy, piezoelectric current therapy. So as we can see, there's a wide range of electroanalgesia for pain management in the medicine today. Why is that so? Well, there's some advantages and disadvantages to electroanalgesia overall. The main advantages would be that there's a lower addictive potential than with opiates. Opiates were commonly used when treating pain for the patients because they would have the same effect on the first neuron by inhibiting the opioid receptors. However, they were highly addictive, especially because the patients were able to take the medication themselves, and sometimes they would overdo it, which would lead to addiction. Also, there's less health threats to the general public, especially because you cannot leave the patient to the treatment by himself, but you lead them through it, which is a lot nicer. However, this kind of therapy is not suitable for everyone. Patients with artificial pacemakers, hearing aids, or heart problems will have a hard time using most of the electroanalgesia therapies because the currents that are applied to or inside of the body may interfere with the pacemakers or hearing problems or with the heart overall. And in the most serious cases, this could even be lethal. Thank you for your attention, and these are my sources.